I'm ready.
No, it's fantastic.
I'm ready. Okay. Hello everyone. My name is Sam and I'll be doing a speech on endometriosis. So ever since I was 12 years old, at least 2 days out of the year, 2 days out of the month, 12 months out of the year, I would wake up or be woken up in the middle of the night in an excruciating amount of pain. And I'd have to crawl to the bathroom to throw up. The worst part is I'm not the only one that this happens to. Many women all over the world suffer from endometriosis. So what is endometriosis? Endometriosis is a condition resulting from the appearance of endometrial tissue outside of the uterus that causes pelvic pain. In this speech, I will be discussing the symptoms, causes, and treatments for endometriosis. So one of the symptoms of endometriosis is pelvic pain, pain with periods, or pain with intercourse. The amount of pain depends on the woman and her pain tolerance, also the severity of the endometriosis. This pain typically presents itself as cramps, but can also be presented in other ways. Another symptom of endometriosis is abnormal vaginal bleeding. National Women's Health Network says that a period lasting longer than 5 to 7 days, or a menstrual cycle being less than 27 days, could be a symptom of endometriosis. One of the last symptoms of endometriosis is infertility. Endometriosis in and of itself causes difficulty getting pregnant, according to WebMD, and it can cause infertility in severe cases. So what are the causes of endometriosis? Unfortunately, there's not a given answer. Scientists aren't really sure what causes endometriosis, although there are some theories. Researchers from Live Science believe that it's an immune system deficiency and that your cells in your immune system are not able to fight off the endometrial cells. Another theory is that menstrual blood flows to other parts of the body and the endometrial tissues attach. Women's Health believes that misplaced cell tissue during the fetal period is what causes endometriosis, and these cells change and develop during puberty. Another theory is that increased levels of estrogen cause endometriosis to grow quicker. And before we discuss treatments, I'd like to show you my visual aid. Okay, so this next picture is going to show what the ovaries and the uterus are supposed to look like. And this picture is going to show what a uterus and ovaries with endometriosis look like. So after a suspected diagnosis, treatments usually begin with over-the-counter pain medications. This includes ibuprofen, NSAIDs, and that is just to ease the cramps. Mayo Clinic suggests that hormonal therapy or hormonal birth control is actually going to be a treatment for endometriosis. Otherwise, you can do a progestin therapy. And if that doesn't work, surgery is usually the next option. You can go for a more conservative surgery, a laparoscopy, which preserves fertility, but it removes the lesions that are inside. And if that doesn't work, you can go to the most severe option, which is to do a hysterectomy and an oophorectomy, which means that you would remove the uterus and the ovaries, says endo.org. And what this does is it removes any place that would cause the endometriosis to have a place to grow, and it would thus stop it. So here is a picture of what a laparoscopy looks like after surgery. You can see that they make 3 small incisions, or however many small incisions that they need. And then they insert their instruments into those incisions. So endometriosis affects over 200,000 women and young girls a year. Menstrual cycles for a lot of people are considered taboo or gross, and so we really don't talk about it. But the reality is that many women suffer from endometriosis, and some don't even know they have it. I didn't. So what is the normal amount of pain? Because I didn't know, and so my pain went ignored. So if someone you know suffers from pain during their period, ask them, have you ever seen a doctor and asked about this pain? Because it's not always normal. Thank you.